So I've been away for some time now, and I know people will be asking where am I in, why you no more posting videos. Life has taken a different turn for me, and I've been kind of more busy into medical practice. I started a new role as a medical officer in the dialysis center about 2 months plus now, and I've been trying to adjust into my new role as the only medical officer in the dialysis center. I work mainly with nurses and other healthcare professionals like lab scientists and some engineers, those that are into the biomedical engineering. It's been an eye opener working in the dialysis center. Since I've been working as a doctor, I've never been so attached, will I say, emotionally and physically attached to my patients, whereby all the patients I attend to, they call me on almost every week, and they have one or two complaints, and they want to see something, they want to hear from me, and all that. And it's been very, very touching because most of these patients, I get to see them when they are almost close to their dying day. Dialysis is looking like where most patients come to die. Somebody was saying for dialysis with a kidney problem, they are just living their last days because most of them don't even have money for dialysis, not to talk about kidney transplant. So it's been very, very touching because you see a patient today, after the next 3, 4, 5 weeks, you hear that the patient has gone. It's not because they don't know the possible treatment for their ailments, but it's because they don't have the financial capacity to take care of themselves. You see some patients that can't even pay for one session of dialysis, not to talk about the subsequent one. And because of that, they tend to go to use the traditional means of curing themselves, and most of them end up dying. It's a place that I'm happy I'm working in, and at the same time, I'm sad. Why am I happy? I'm happy because it has given me a new experience in the line of medical practice here in Nigeria. At least I've seen that, yes, as a doctor, you can be really, really invested in your patients. In as much as we are taught to have empathy and not sympathy as a doctor, but some patients have shown me that life is beyond what we see today. Life is beyond what we think life is. I'll give a story of one of my patients, a female. I think she's now up to 30 years. She had kidney problem due to she has been diabetic since she was a child. She had type 1 diabetes, which has led to nephropathy, that's diabetic nephropathy. Each time that girl comes in for dialysis, I weep, I cry, I bleed inside because I feel, what if it's my child or my relative that is going through this? And the bad side of it is that her mom died of the same thing. Her mom was diabetic and she also had kidney problems. She also did dialysis and died. Now she is passing through the same thing. And each time she comes, she will call me, doctor, please scratch my back, rub my back, please, I'm having pain, please come, stay close, don't go. And I became so attached to her that each time I don't see her, every day I make sure I call to make sure that she's doing very well. And the day she died, she almost died in my hands because she came in for dialysis. Even before the dialysis, the nurses were trying to set up the place. The technicians were priming the machine, and she just lost consciousness. And when they tried to resuscitate her, and it was so bad that we had to transfer her to ICU. And within 2 days, I think the evening, the next 2 days, she died. And I felt so bad. Coming to work the next day I was like, it doesn't worth it. It doesn't worth it because after all, most of these patients will end up dying. So what am I killing myself? So I've learned so many things as a medical officer in the dialysis center, and my patients are now like my family because it's like I'm seeing them in their last few days to their dying time. And I tend to come to appreciate life more. When people talk about kidney issue and they talk anyhow, especially this case of the Korean that just passed a few months ago, feel so bad because I need to bring them to the center to see people with chronic kidney problems and how difficult for them to go through a day-to-day life. I even have a patient that is suffering from diabetes, also suffering from HIV, and at the same time suffering from kidney problem and hypertension. It's that bad. It's so, so bad. I never knew kidney problem would be this bad because back then when I was working in the hospital, we just see them, we give them medication and send them for dialysis. But now working in the dialysis center, I become so, so, so attached and invested into them. And sometimes I feel I'm a magician. I can just do something for them to just get well immediately. It's very, very bad. Most of them don't have the financial capacity. The ones you see living long and doing well are those that have the money to be coming for dialysis, or those that have the money and can go for transplant, for kidney transplant. But the ones that don't have the money, what can they do? Recently, I had a patient that came for 2 sessions of dialysis and he told me, Doctor, please, I can no longer afford this. I'm going home. He went back to his village and it didn't take him up to 2 weeks. I heard he died without dialysis. It is that bad. It is so, so bad. So please, if your kidneys are functioning, if you're living a healthy life, please continue to thank God because not everyone has this opportunity. Not everyone has this opportunity that you have to have two functional kidneys and a very good health. So guys, continue to take care of yourself. Avoid doing those things that you know that will damage your kidneys. Very common things. Avoid abusing painkillers, especially painkillers. Avoid abusing them. The NSAIDs, you know them, the diclofenac, the ibuprofen, and so on. If you're a hypertensive patient, please always make sure your BP is under control because hypertension is one of those things that can increase your risk of developing kidney problem. And also, if you're diabetic, please always make sure your blood sugar is in control as well. And try to avoid infections, glomerulonephritis, and so on. These are the things that can place you at risk of developing kidney problems. And for those of us or those of you that have a family history of kidney problems, because some kidney problems can be genetic as well, please make sure you always check yourself and try to avoid things that can damage your kidneys. Most people don't even know that things like herbal medications can damage their kidneys. So please stay away from it. Remain safe and always remember your health is your wealth.